The word patient comes from a Latin word that means to suffer. And in no context is the word or term patient more apt than in chronic pain. I don't think a week has gone by in the past few years where someone hasn't come into the office and asked me sincerely, can you help me end my life? Because it hurts so much.
I was diagnosed with complex regional pain syndrome in 2010. I was unable to really get out of bed or walk around for the better portion of a year.
I've been dealing with Crohn's disease for 44 years. My first surgery, I believe it was on my 21st birthday, and that interfered with my college when I was going through university. And it caused such an interference with the varying surgeries that I had that I couldn't continue my college. And I never made it back to college because of all the side effects and the pain I was dealing with because of my Crohn's disease.
In October of 2016, I had horrible pain in my knee out of nowhere. So I went on a wild goose chase, went to all these different specialists, but I ended up at Penn. And they pretty much couldn't figure it out. And so then I was just on pain management to just trying to get by for the time being.
CRPS undoubtedly is like I was in a body that I just couldn't recognize. I didn't even know how to describe how it felt to the doctors.
My little understanding of CRPS is just a very rare, very painful nerve condition. It doesn't really make sense in some ways, like the pain will transfer from his leg to his shoulder. His pain has gotten way better within the years, but there's still a couple weird side effects and things he has, and I actually haven't met anyone else who has it.
I saw, I think, 5 doctors before I believed that I actually had CRPS.
There is another great problem with how we approach chronic pain. Since the 1980s, physicians, policymakers, and patients at large have been trained and conditioned to think that if pain is real, if it's something that comes from a broken bone or a damaged nerve or burned skin, the solution for that pain lies with a dose of one class of medications, and that's with opioids.
There really wasn't anything you could do but use opioids. The pain was just so overwhelming and unbearable that there was not any other option for me at that point.
You have the feeling of euphoria. Sometimes your decision process can be affected. You definitely don't always want to be driving when on it, so that may put a damper on your day. Thank God, knock wood, I haven't been addicted to it, but I still don't want to take that chance.
There are so many different types of personalities that handle pain differently. There's always a level of frustration, especially as an ER nurse, to have somebody come in just feeling as though that's all they're there for are drugs. And you want to, as a nurse, you want to make them feel better. You want them to be stronger. You want them to deal with this without having to come in and just ask for pain medication.
And so what happens today is patients go to the ER, and in this city, in Philadelphia, you wait. And you wait because ER patients are triaged, and you wait.
It's like being on trial, where you're trying to convince them that they have something you need.
You know, they would naturally start asking questions about my symptoms, and I would start describing, and frequently you get looked at like you're some kind of hypochondriac because you're sitting there in front of them and you look completely fine to them.
With the way things are in today's society, so many people becoming addicted to pain medicine, doctors want to be careful about how much they give because, God forbid, if you get addicted, no doctor wants to see you get into that position. And I've actually been to a couple emergency rooms that say, "Oh, I'm sorry, we don't treat pain." I was floored when I heard that. I've never heard that.
In my family, my father goes, "Are you still on that pain medication?" And I say, "No, Dad, it's something different. It's not really a pain medication." And then he writes it down and researches it. Nothing works. Sometimes. Just for pain, they're just not going to do anything. They'll send me home with ibuprofen.
When you've dealt with the clinical setting and your friends and family don't understand it and don't get it, like you're in this place where you mentally just feel like, oh man, nobody's on my side, nobody's in my team. And I think that victimhood, I realized, was a poison. That was the number one thing to overcome too, was mentally.
He had a couple moments where his pain was so bad, not that he was thinking of taking his life, but he didn't know how much more he could handle it. He was young, but couldn't see a full life ahead of him living with that amount of pain. I think I said even, if I wake up and you're not there, like, I'll know you tried your absolute best, you tried your hardest, and that it wasn't that you wanted to leave me and the kids, it just was too much.
The other side of that story is, I'm sitting there watching her deal with all the household chores and all that's on her plate, taking care of the kids and me on top of just her normal workload. And I just remember turning to her and saying, "You know what, dear, like I love you, and if it ever is just too much and you just, like, you're at your breaking point and you're just done and you need to just be done with all the caretaking and you walk out that door and don't come back, I will tell everybody you loved us and you held on to the bitter end."
It's frustrating to patients, and I think patients feel gaslit. They feel like they're being told that they're suffering and the hospital system is telling them they're not suffering. I don't think the healthcare system is intentionally gaslighting pain patients. I think what the ER doctors really do care that patients are suffering, and they want to do whatever they think is medically reasonable and appropriate to help patients suffering with chronic pain.
And they threw everything they had at me, anything that they knew how to do or whatever. And I was running out of options.
You're thrown into a completely different world, and it's easy to feel like you're never going to get out of that.
I think the reason the chronic pain patients suffer so much in this healthcare environment is because the healthcare environment doesn't ask the question they should ask. What they ask is, how can we make the most money possible and do that as often as we possibly can? The question that the government, healthcare system, presidents, that policymakers and politicians should ask is, what interventions and systems can we put in place that will effectively help the populations of patients who are suffering with chronic pain?
I don't want to have to be walking through life in a cloud. So when I found out about ketamine and things that it could do for you, I said, by all means, let's try it.
Ketamine is a drug that's been around since 1960. It's a general anesthesia induction agent. And what that means in plain English is it, in the right doses, obliterates consciousness in a reversible way.
As far as pain goes, and even depression, ketamine's a really cool drug. It blocks the NMDA receptors, two neurotransmitters. Those are receptors that kind of decide how our body is going to feel pain. You know, if somebody has severe depression, and they have this recurring thought like, I'm worthless, I'm useless, I'm nothing, which is what we hear a lot. Ketamine kind of helps people build new pathways to think, to not think that, to break that pathway, and to think something else, something more positive.
What it doesn't do is it doesn't stop your heart. It doesn't stop your breathing. It doesn't drop your blood pressure.
There's no surprise to me after having done the research why ketamine is an effective drug for psychiatric illness and for chronic pain. And I think that that's a benefit that a lot of chronic pain patients could take advantage of.
It has done a great job. I've come into the infusion center here a couple times in pain on a scale of 1 to 10, where it's been a 9 or a 10. And taking the ketamine infusion just dropped that from like a 9 or 10 down to a 1 or 0. It really, really helps, and thank goodness. And it's such a relief to know that I'm gonna come down and be treated and have that pain knocked out and be gone for a very long time.
IV ketamine is really cheap. Coming in a couple times a month or a couple times a week to get an IV ketamine treatment is so much less expensive than a hospital stay.
We have the opportunity to help them in other ways, to help them become stronger, better people that just aren't living to live for pain medicine.
All of this happens because we need help. You know, that's what it is all about. I agree.
And then they recommended this place to you.
Yes.
And I believe it was a lifesaver.
It is.
There's more to healthcare than just being in the hospital, and there's better ways of managing things for sure. Hopefully it's something that will help them and to give them some kind of benefit that they've never seen before.
I went and tried these ketamine infusions. It took me like a few years of being on it and then working closely with a physical therapist. And I got to the point where my pain subsided, and after being bedridden for 4 years, I was actually able to walk, and now I'm pretty much 90% of my old self. Physically, I can do almost anything, so pretty lucky in that aspect. Even just existing is a huge role, and people notice, and we need you to push on. We need these chronic pain patients to hang in there because we affect way more than we realize.
I've had a lot of people that says, Chris, you qualify for total disability. I can't do that, that's not me. I like to work. I'm old school, that's how I was brought up. I just try and keep going and plow through. It might be hard some days, but that's what I do.
When a patient is describing to you what their experience is, don't invalidate it. You might not understand it. You might not think it's accurate, but don't dismiss it.
The reason I opened my office and started offering the care that we offer, it started with the core premise of access to care when they need it, and not just treating pain like it's a deficiency of opioids in their bloodstream. Our office aims to communicate to patients that it matters that they're suffering, and that if they want help, we'll give it to them as best as we can. Of course, not every form of chronic pain can be cured, can be fixed, as much as we try to help with that. I think that shows the power of this approach of just listening to patients and believing in them. And that's why I do this. That's why I opened my clinic, was to give an answer to that. What can we do if we're not doing opioids? And the answer is a lot.